All right, in this lecture, we're going to spend some time, significant time, talking about the patient with radiation injury. Now, it is my impression from years of hyperbaric practice that patients with radiation injury is that group of patients that responds exceptionally well to the benefits of hyperbaric oxygen therapy. We're going to share with you some data to support this, as well as some clinical findings that also support the use of hyperbaric oxygen therapy in radiation injury. So what are we going to do through this lecture? We're going to talk a little bit about background information related to radiation, some of the physics of radiation therapy. We're going to talk about the pathophysiology, very important for you to understand the impact of radiation on tissues as it relates to hyperbaric oxygen therapy. This then will serve as a foundation to explain the rationale for the utilization of hyperbaric oxygen therapy in the treatment of these patients. We're then going to go to the literature and spend some time looking at the information that's available to support the rationale and use of hyperbaric for patients with radiation injury. Then I have a real treat for you. Dr. Serena and I are going to tag team on this lecture. He's going to spend significant time talking about clinical correlations in this area and share with you information not only on the clinical applications of hyperbaric oxygen therapy for the patient with various types of radiation injured tissue, but he's also going to share with you some very exciting data, new data related to data that was produced through the radiation registry that will hopefully be published this year. We expect to be published this year by the American College of Hyperbaric Medicine. And finally, I'll come back with and close the lecture with some additional clinical correlation and utilization guidelines. So if you're ready,